actually back in 1987, there were no such thing as AIDS service organizations. When an individual received a diagnosis of HIV, they were pretty much told to go home and make their arrangements to die. And that's really where we stepped in, helping those folks navigate the system and really helping them with the process of dying. Here we are, fast forward 20 years later, and we're a comprehensive AIDS service organization. Here at the network, we offer our clients case management. We offer prevention and education. We run a needle exchange program. It's a really comprehensive network of services. But for the individual and their family living with HIV, we're here to support them. That support encompasses referrals and linkages to doctors, infectious disease doctors. We'll also make referrals for mental health counseling, or we'll do it here on site. We run a food pantry because we know nutrition is a key part of the individual feeling well and being able to tolerate their medications. Food pantry. We run support groups. We have food and thought groups. We have support groups for folks who are positive and for other family members who might not be positive but are also affected by the disease.
Something people don't want to talk about and something people don't seem to think is here in Maine, but it is prevalent. There are over 1,500 people in the state currently infected with HIV, and nationwide, 1 in 4 people who are infected don't know that they have it. So education is just the most important thing, and connecting with people so they really understand. Definitely have to break the ice. It depends on your audience. We were recently at an area high school, and the second you say condoms, they're all the giggles. But at the same time, although they may react with a laugh, at least you know they heard you.
Sometimes you don't get well recepted in certain areas, so it's sometimes that's a little bit of barrier, or just the uneducated. They don't know about HIV or AIDS, so that's kind of a barrier too, because they think, some people don't really know much about it, so they think it's like a gay disease or whatever. They don't think it's up here in Maine, but it is here.
People are kind of walking by and looking a little, hedgy. We'll say, hey, what can we do for you? These things are free. And so hopefully they'll take some condoms or ribbons or, information. We have a whole bunch of things here that we're giving out. So
people think that AIDS is over and that the epidemic's over, but it's really not. It's still a big problem, and it's still something we need to be, worried about.
I lost my mom when I was almost 12 and my sister this past April. And for me, it's just very important to get out there to explain and help prevent, because this is something that's not being talked about, and it's not, people are ignoring it and thinking that you can just take a couple pills and be fine, and they don't take it seriously and realize what an impact on your life this has. I do. I feel like it's almost like it's my duty to speak to people, share my experiences, and explain to them not so much anymore about how you can't get it, but how you can, and the things they need to do to protect themselves, because now things are very different than they were when we were in high school and middle school. Sex ed isn't what it used to be. A lot of the schools have taken the abstinence-only money, and they're not teaching about condoms. They're not teaching about safe sex and STDs like they should. And it's like we've taken 1,000 steps backwards, and I feel like it's up to us to come in and get that information out there where the schools can't.
On confidentiality, I try to reassure them that no one's going to get their name, or I'm not going to be calling them, just to talk to them. It's just more of what I see here or wherever we are stays with wherever I am. Like pretend like I don't know them and not say anything, so I don't disclose how I met them. I guess I'm just taking it as a personal self because I'm positive, and when I had to tell my family, it was more of a shock and more of, some people, didn't talk to me for a while, and then, were more supportive and caring and wanted me to be well and stuff. Break bad news to somebody, it's more of a challenge to get them to talk more. Well, it's a tough to hear when you're positive, because there's such a stigma with it, so people tend to not talk and not say anything because it's more of a shock than anything. So it's really hard to get him to open up and stuff.
EMAN's facing a lot of financial challenges right now because one of our major funders is the state of Maine. And anyone who reads the newspaper knows that the state of Maine is having a revenue shortfall. The other thing is that we get a lot of community donations from people who have been generous with our organization over time. But everyone's being really hard hit by the current economic times. And so, like everyone else, I think we're seeing donations go down. And at the same time, our expenses aren't going down. If anything, they're going up. One of the reasons that I'm involved in EMAN is that I'm a person living with HIV and AIDS. And I know how important it is to have an organization like EMAN.
Yeah, I do, because there's such a stigma that goes with it. I mean, because they think that you know it's a death sentence, and basically it's not today. As long as you get the help and care that you need, as you're taking care of yourself, you can live a very long and full life. So, and I think people just need to know that the sooner they get, if they do have it and can get on medication, it's better, because you're not dying.
Protect yourself. That's the biggest thing. Protection and education. The only way we're going to stop the spread of HIV is to just spread the word.
It's the Jersey shoreline, trapped in my mind.